Welcome to Fempower Health. This is Georgie. Before I dive into today's piece, I want to share why this topic struck me. If you've ever felt like your health concerns were brushed aside or that your pain didn't seem to fit the chart, you're not alone. But here's the thing. It's not always about bad doctors. While many on social media do like to villainize the doctors, it's not necessarily the case. Instead, most of the time, it's about the bigger systems that they're working in. Women's health research has huge gaps. Many conditions that mostly affect women have been overlooked or underfunded for decades, which means clinicians often don't have the right tools, time, or information to help us the way they want to. That's why this quote from Kate Fagan really hit me. Kate's a sports journalist and former ESPN commentator, and she was on a TED Radio Hour episode talking about women's sports. She said, "Women's sports, collectively, as a culture, we haven't decided it matters. And if this thing doesn't matter culturally, we're doing it almost as a form of charity. Do it for our girls instead of, these are the best in the world." She was talking about athletes, but I couldn't stop thinking about how true that is for women's health, and honestly, for any area that stays a blind spot until we decide it matters. And that's what the piece you're about to hear is about. The hidden ways our culture shapes what gets researched, funded, and fixed, and what we can learn from sports about how to tell a better story. If you feel like more people need to hear this, please share it. The more we see these blind spots, the better chance we have to close the gaps for everyone, including the doctors who want to help. Let's dive in. What we don't see, we don't solve. The cultural blind spots in women's health. From endometriosis to IUD pain, women's health isn't failing, it's been overlooked. And what we fail to value, we fail to fix. Women's sports collectively as a culture, we haven't decided it matters, and if this thing doesn't matter culturally, we are doing it almost as a form of charity. Do it for our girls instead of these are the best in the world. And that's Kate Fagan in the TED Radio Hour episode on women's sports. And yes, that quote is so good, I had to say it twice. So Kate Fagan wasn't talking about women's health, but she could have been. While reflecting on the underfunding and undervaluing of women's sports, she made a point that echoes far beyond the playing field. When we don't decide something matters, we don't invest in making it better. And that's the exact dynamic we see in women's health, whether it's research, clinical care, policy, or media coverage. And if we want better care, we need better storytelling. Not in the sense of marketing spin, but in the sense of narrative investment, the kind that sets stakes, creates visibility, and drives action. So let's talk about what women's sports reveal about systemic blind spots. So in the TED Radio Hour episode, Kate Fagan described a dynamic she called gender bland commentary, when men cover women's sports with no depth, no storylines, and no preparation. When those segments fail to attract viewers, the blame is put on the sport itself, not on the flat storytelling. But if the same happened with a men's game, they'd try again with better prep, better angles, and better stakes. The same thing happens in women's health. When research on endometriosis or PMDD is inconclusive, it's not because these conditions aren't real, it's because they're biologically complex and historically under-prioritized. We haven't built the right frameworks, tools, or study designs to account for that complexity. And instead of addressing the limitations in our systems, the burden often falls back on women labeled as too emotional, too vague, or too difficult to treat. And this isn't about a lack of interest. It's about a lack of infrastructure, investment, and intentionality. And it reveals a deeper cultural blind spot. We haven't treated women's health as enough of a critical scientific priority. From the sidelines to waiting rooms, what's missing? Sports blossom when they have stakes and storylines. The Olympic gold medal, the jersey you root for, the underdog tale you follow. And men's sports have generations of this. Women's health, on the other hand, often lacks both. Let's look at a few examples. Endometriosis, the stakes, infertility, chronic pain, school and work disruptions, and lost wages. The storylines, largely absent. Many women hear about the condition for the first time years into suffering. Even fewer understand what treatments are available or why a diagnosis takes an average of 7 to 10 years. Autoimmune disease. Over 80% of autoimmune patients are women, yet clinical trials rarely center female biology and diagnoses are delayed or dismissed. The stakes? Fatigue, organ damage, years on ineffective meds. The storyline, confusion and invisibility. Pelvic and sexual pain. The stakes, chronic pain, loss of intimacy, mental health struggles, and avoidance of care. The storyline, still hidden in whispers, not public health campaigns. Pelvic and pain with sex have many possible causes: endometriosis, vulvodynia, hormonal changes, trauma, but few clear diagnostics, short appointments, cultural taboos, and gaps in provider training mean sexual health is rarely asked about, and many women feel ashamed to speak up. Even common procedures like IUD insertions went unmanaged for years, and ACOG's pain guidance only arrived in 2025. The real question isn't just, why does it hurt? It's why did it take so long to acknowledge that pain matters? Why this isn't just a science problem, it's really also a cultural problem. Women often blame themselves for their pain. You've heard these before or said them yourself. Why didn't I speak up sooner? Maybe I'm just stressed. I should have advocated harder. But you can't self-advocate your way out of a structurally underfunded system. You can't lean in to get a clinical trial redesigned. That's why this goes beyond medicine. This is about how we frame value. We've long said that women's health is underfunded or under-researched. That's true, but it's incomplete. The reason it's underfunded is because we don't see the stakes. We don't know the story, and so we let it slide. Until it's your daughter who can't get out of bed because of period pain, your wife who's cycling through meds for unexplained autoimmune flares, your mother who spent a decade misdiagnosed. Then it becomes urgent, personal, unacceptable. We need a cultural rerun with better scripts. Here's the kicker. When men's sports don't land, they get another shot, a new angle, better storytelling. Yet when women's sports don't land, we scrap them. When a man's treatment plan doesn't work, it's refined and finding a cure is prioritized. Yet when a woman's doesn't, she's told she's non-compliant. Don't believe me? Viagra was launched in 1998, but the first female Viagra, so to speak, Addyi, was launched in 2015. The problem isn't just the data. It's the narrative framing that tells us what deserves refinement and what doesn't. So let's talk about the Fempower Health perspective and how we bridge the gap. At Fempower Health, we believe that solving women's health isn't just about more studies or new tools, though we need both. It's about changing the culture that determines who gets heard, who gets funded, and who gets prioritized. We exist to bridge the patient-doctor gap and to connect it to the broader systems shaping care, and that's policy, pharma, venture capital, and media. Because what gets watched gets funded, what gets funded gets studied, and what gets studied gets solved. So what's the TLDR here? The 3 things we can learn from women's sports. Number 1, invest in the storylines. If we don't show why women's health matters in our pitch decks, when we talk to our doctors, when we talk to the men in our lives, anyone we talk to, it will stay invisible. And we need to define the stakes. It's not just a period or just hormones. It's fertility, function, dignity, and dollars. And lastly, refuse to settle for gender-bland care. Women's health deserves precision, not pity. Thank you for listening to the episode today and for caring enough to see what so many people miss. And if this made you think of someone who'd get it too, share it with them. That's how we make these blind spots harder to ignore. Until next time, take care of yourself and each other. Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find a link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.